5 cases and counting. That's the number of people across New York City and Long Island who tested positive for the Omicron variant. A 67-year-old female from Suffolk County, 2 people in Queens, 1 person in Brooklyn, and the 5th case in Manhattan. Doctors are still trying to determine all of the patients' vaccination histories.
So one thing is for sure, city and state leaders are on the same page about how to get a handle on Omicron.
I want to make sure everyone understands this is about unity. There's a reason we're here together to signal that this is a challenge that we're going to tackle together and ensure that everyone knows that we're focused on transparency, which means we'll provide information as we get it, as well as a coordinated response from the city and the state to deal with whatever lies ahead.
So New York City Health Commissioner Dr. Dave Chokshi is here with us this morning to really give us an update on the latest cases, as well as any new changes in safety protocols that we should all be taking. Good to see you, Commissioner. Thanks for being here on an important morning.
Good morning, Hazel. Good morning, Dan. Thanks for having me.
So, Commissioner, let's begin with this. Since last night's briefing with the mayor, have there been any new cases detected in our area? And also, when we look at the totality, right? I remember when coronavirus first started, we were so focused on the number of cases. Are you doing that in this case with the new variant, or it's just not as important in terms of numbers?
We have a total of 5 cases thus far, 4 in New York City, 1 in Suffolk County. So no further additions, since what we announced last night. But the second part of your question is really important. Beyond the number of cases, what we really want to emphasize is that this shows that there is community spread of the Omicron variant. And that means we have to take the steps that we know will work to curb that spread.
Now, because we have a lot of people that commute into the city, people coming from New Jersey, people coming from Connecticut, have you also been in contact with their health departments to find out if any cases have popped up there?
Yes, when there are cases that cross jurisdictions, we're always in regular touch, both with neighboring health departments or yesterday, as you know, there was another case that was announced by Minnesota that had spent some time in New York City. So we collaborate with that health department as well. And often the CDC helps to coordinate this. So we're in very close touch with our counterparts.
So we're assuming community spread. We're assuming there will be more cases, right? Because you said yesterday that you're testing often for this new variant. So do we know yet whether or not this specific variant is highly transmissible? What does that mean for anybody who maybe came in contact with those 5 patients or with that Minnesota man who attended the convention at the Javits Center a couple weeks ago?
There are 3 important questions that we're trying to clarify the science around. The first is transmissibility. How well does Omicron spread compared to other variants? There is reason to believe that it may spread more efficiently. The second is the severity of disease related to the variant, and we still just need to learn more about that. And the third is the effects on immunity. How will the vaccines hold up? We do believe that they will retain some effectiveness, but precisely how much will take a few more days to weeks to actually clarify. To the other part of your question, what we're encouraging right now, of course, vaccination, particularly for children, if you haven't gotten your child vaccinated, and also for all adults to get their booster dose. And then I issued a commissioner's advisory earlier this week, encouraging mask use, particularly indoors. And finally, testing, particularly if you have traveled or gone to a gathering.
Because of what we know so far, or, we don't know the full story yet, a lot of people don't know how to feel about this because we're hearing that some of the symptoms that people have been having are not as serious as like the Delta variant, the reactions to the Delta variant. So, how should we be reacting to this? I know you said don't panic, but when we feel like the symptoms aren't that serious, some people might think, oh, I shouldn't have to worry about it then.
I do understand that. First, I would just say, take what you're hearing, in terms of the initial reports around severity with a big grain of salt. We need a little bit more time for the science to really be nailed down on that point. So while I'm hopeful that, that this will be less severe as a variant, we certainly can't say that with any degree of definitiveness right now. But in terms of how we should feel about this, look, there is some reason for concern. And I want to be forthright about that. But New Yorkers, we don't just wring our hands. We are taking action. There are the steps that I've described that the city and the state are taking. And there's something that each of your viewers can do as well. Go out and get vaccinated. Make sure you're wearing your face covering and get tested.
So can things, you're saying there's a lot of unknowns, right? But there's also a lot of things coming in the next couple of weeks. The Christmas holiday, New Year's gatherings, right? Especially in Times Square. You said you issued the mask guidance. Do you see that changing with new information? Could that become a mandate once again to wear masks indoors? And what is your advice for those folks entering the holiday season?
Yeah, we're thinking about all of these things carefully, day by day as we get new information about Omicron. Right now, the mask advisory is an appropriate step, but the mayor has said all options are on the table, particularly if we see conditions worsening. So, those are things that we're actively considering. With respect to gatherings, I do encourage people to be, vigilant with respect to wearing their mask, getting tested before and after. And for your holiday gatherings, just a very practical point of advice, plan it around your most vulnerable family member. It could be a child who's not yet eligible to get vaccinated. It could be an older adult. Keep them in mind when you think about how to protect them.
Just to zero in on something you just said, that all of this could change with the new information that comes out. What would issue a mask mandate? What are you looking for in the data that would change your mind on the guidance?
Well, we're always, following the numbers. That means the cases, but particularly the severe outcomes, hospitalizations and deaths related to COVID-19. Right now, we are seeing cases increasing across the city. Hospitalizations have started to increase as well, but to a lesser degree. So those are the things that we're going to be following very closely. But remember, vaccination in particular helps to avoid the most severe outcomes from COVID-19.
And just real quickly, how is the city doing with the supply on vaccines?
We're doing just fine. We have plenty of vaccine. I encourage everyone, go to nyc.gov/vaccine finder or call 877-VAX4NYC. We can get you in today if you need your booster. If your child needs a vaccine, we'll accommodate you anytime you want to come in.
The cases that are increasing, and you're saying in the hospitalizations that are increasing, is that from the Delta variant? What are you seeing in terms of those, and is it more just the unvaccinated?
Yes, Delta is the devil that we know, and the vast majority of cases right now are still attributable to Delta. It's upward of 95% of all of the cases that we're sequencing. We also do look at cases in terms of unvaccinated versus vaccinated. What we find is that unvaccinated individuals are over 7 times more likely to be infected with COVID-19. This is why you hear us emphasizing vaccination so much.
All right, Dr. Dave Chokshi, thanks so much for taking the time to speak with us this morning. We had so many questions for you, and you did a great job explaining that to us this morning. So thanks again.
Thanks for having me.
Can we sneak in one unrelated question to the variant, and it's the new commercial. When did we change it to Dr. Dave?
Well, that was a shorter commercial, and I was feeling in the holiday spirit, so Dr. Dave it is.
All right,
Dr. Dave. We appreciate your time.
Thank you so much.